Liana, I'm so excited to have you back. Thanks you for coming, and I'm really excited for this episode.
Thank you so much for having me. I'm excited to be back with you. And I'm also looking forward to chatting about this. It's one of my favorite topics. I love chatting about anything anxiety related. So thanks for having me.
Yeah, you really come into this being a big specialty for you, really working with clients on that anxiety piece of not only health, but in so many other ways in life. And it's so important because it's one of the biggest questions I think that we get. Like, I'm so anxious about this. How do I stop the anxiety? Right? It happens all the time. And so I think this is going to be a really helpful episode. And yeah, first and foremost, let's just have a little check in of where you are in your practice. How's Austin life? Just give us a little second of how you're doing.
Yeah, Austin's amazing. We're like coming into the springtime, which is like such a short period of time here, and it's just the most perfect weather. Um, and I'm doing a lot of in-person work with my clients now, which I love so much, especially in working with anxiety. I find that I really enjoy kind of just like the co-regulation part of the work, where I find I find that to be stronger. For me personally, I feel it more when I'm doing in-person work, so I'm really enjoying it. Life has been good.
Awesome. And you've been doing a lot of trainings too.
I have. You've been in there with me. We've been busy with this.
Yeah. Anything stand out to you in terms of that? Like, what are you loving right now in your training or trainings, or like, what do you love? I said that twice. What do you love about your trainings right now?
I think we talked about this when you were in town, but I think one of the things I've really enjoyed lately is getting a better understanding of really incorporating movement in an intentional way in session where I'm following the client's body and their cues that they're giving off in session, because our bodies are, always said this, they're infinitely wise and they're always trying to help us. And I've gained a lot of information recently about really being able to pay attention to how somebody's body is subtly moving and helping kind of guide them through it, often to help bring in more regulation into their system. But it can also help a lot in helping complete stuck trauma cycles that never got to happen, and so it gets stuck in the body. I'm loving
Yeah.
that.
Yeah, which is so much where health anxiety comes from. When things get stuck, right? We get really fearful about what could or should happen. And a lot of times that's because we were never able to complete a stress cycle, a trauma cycle.
Yep,
Yeah.
absolutely.
Yeah. Okay, so then let's jump right in. Why don't you kick us off? Like what exactly is health anxiety? What are we talking about here?
Yeah, health anxiety is a really intense, very persistent, kind of overtaking worry that something is seriously wrong with your health, even though there's no medical evidence to support that. And sometimes it can stem from a condition that you already have or symptoms that are actively present. But other times it can come from a really big fear, a real fear that you're going to develop a serious illness in the future. Some signs of this can be like if you find yourself just kind of like frantically Googling anytime you have a symptom, or feeling really nervous before certain situations, like maybe going out to eat or trips, or just very convinced that the doctors are missing something. These are clues that you may be dealing with health anxiety. And I think something that you and I talk about a lot is that, even though a lot of the work that we do, it's brain based, but if you are experiencing symptoms, like it's not in your head, like the fear is very, very real. But the key differentiator here and in the work that we do is that it's not rooted in anything physical. There's nothing wrong in your body. It's actually your brain and nervous system's perception of there being something wrong.
Yeah, I think that's a really important indicator. Health anxiety is real, is true, it's happening. And I mean, how could you not have anxiety about symptoms that are unexplained or not being helped or continue to drive so much dysregulation, fear, pain, symptoms in your body? Yeah, you're going to have some anxiety around it because it's unpredictable. You don't know what to do with it. Actually, just talking to someone who was describing to me that he's had these symptoms that have lingered from getting the flu a couple months ago, and he didn't understand it. Honestly, I didn't want to jump right into it, but it really sounded like chronic fatigue, right? But his main thing was like, I just don't understand. I don't get it. Like, I don't understand what's happening, and no one can tell me what's wrong. And so then he said, he was like, yeah, I'm not sleeping. And like, I have so much anxiety. I can't work. I'm not, so of course you can't. I mean, of course there's anxiety because you're not sure what's going on. And so, yeah, I think understanding those signs, like if you're constantly ruminating, if you're constantly thinking over and over again about what's going to happen, what's not going to happen, if you wake up being fearful about how your day is going to go because you're afraid that something that you don't know or some food will trigger your symptoms, that's a big one. Constantly Googling, can't stop Googling symptoms. That's a rough one. And I also think we didn't plan to talk about this, but I wonder if we can talk about the difference between health anxiety and hypochondria,
Mm.
right? Because people will call it that, or it's kind of this word that no one really wants to use, or it's used too much. But I also think it's important to just talk about and normalize in a way, just like explain it. Do you have thoughts on that, the difference?
Yeah, can we do a quick pause?
So first, let me say this, that the label hypochondria can be a label, can be a diagnosis. At the same time, the way that we think of diagnoses is that on one hand, sometimes it can be helpful to understand something, right? To put language to it, to help you recognize maybe some things you didn't realize and give it a name, because it then becomes known when you weren't sure what was going on. At the same time, I think that we both believe, correct me if I'm wrong, that they can also be really limiting. And I think I've actually shared this on the podcast as well, that giving a diagnosis without the explanation that it can change. It's not your forever. It's not your life, right? Can be harmful, can be really harmful to someone where you just slap a label on and you think like, that's it. That's my life. Oh my gosh, what's that? What do I do? So I want to put that out there before we go into this and recognize that we're going to describe the difference and also realize it's a spectrum. Like when I was in school, I remember being in class with the DSM, the diagnostic manual, and the professor was like, now you're going to flip through all these things and you're probably going to find yourself or someone else have markers of anything, everything, right? It doesn't mean you fit the whole bill, you fit the whole box and that something's wrong, right? At the same time, yes, it can be helpful to understand what's going on and to give it a name. So, with that little disclaimer, what are your thoughts on the differences? Like, how would you explain that to someone? What's the difference between meeting maybe more criteria for hypochondria and having some health anxiety?
Yeah, and thanks for that explanation on diagnoses. I know that you and I share that perspective. But yeah, as far as the difference, I would say health anxiety is much more general, can still like create a lot of kind of like debilitation, but it's going to be more sporadic. Maybe not an intense part of your life in an ongoing kind of a way. Whereas when I think of hypochondria, this is going to be really intense rumination about health and disease on a daily basis. It's going to be very disruptive, very debilitating. And your description of it being on a spectrum is spot on, right? Because like I would call them like someone who doesn't deal with any of this kind of like at the bottom, health anxiety kind of in the middle, and then hypochondria on the far end of that spectrum, the most extreme presentation.
Yeah.
So like maybe even example could be helpful. Like, we all kind of will have those nights where we like maybe sleep wrong and are in a weird position and then we wake up and our neck is sore. Many people will wake up and be like, oh, I slept weird. No big deal. This will go away in a day or two. Someone with health anxiety might think, oh gosh, like what if I injured my neck? What if something's wrong? Maybe I need to go see my chiropractor today. Someone with hypochondria is very likely going to wake up and think, oh my gosh, like I have a tumor in my neck. Like I have cancer. Something is wrong. I need to like go to the ER and like make sure. I need to get scans. I need to get lab work done because they are convinced that a tumor is in their neck. So that's kind of like the way it can present itself.
That's a really helpful, clear example. And if you're listening to this and you see yourself fall in one area or the other, or maybe you're a little bit more in the health anxiety and you're like, wow, I've never thought that way before, or maybe that extreme, right? I've heard that multiple times. And this is not a initiation for you to start thinking in the higher anxiety states with your body. It's just examples. And I think that this goes right along the lines with like helping us understand like how does health anxiety actually affect our mind and our bodies. And so when we're talking about the mind body connection, especially with chronic symptoms, we know that it's a cycle because on one hand, our health anxiety increases fear, which increases our symptoms. But then also our symptoms increases our fear and anxiety, right? Like chronic pain and fatigue are two conditions that totally perpetuate anxiety because there's usually a very real reason that you would have anxiety because your body's in pain or your body has something going on that you don't understand, thus triggering more anxiety. So it creates that stress response, creates more of a chronic state of stress within our bodies, which we know when the nervous system is stuck in the stress response and hasn't been able to fully express that, go through the cycle like you were talking about earlier, then our bodies can lead to actually all types of different illnesses or symptoms, lead to inflammation, lead to organ failure, lead to pain, lead to the shutdown response, which is really chronic fatigue. I mean, that's just a few tiny examples. And so it kind of perpetuates each other. And so we know that when this happens time and time again, the mind and body just can't really relax very well. So with that, it's hard to shift it. It's hard to shift out, but it's totally doable. And actually, I would say this is probably one of the biggest things we help people do, right? Because when you're in a constant state of fear, your body can't relax, so your symptoms can't relax. And there's always new levels of it. So with that, I know I think I took over what you wanted to talk about a little bit, but what would you add to that like pain fear cycle?
Yeah, I mean, you're right. Like that is the foundation, I think, of a lot of the work that both you and I do. Um, and, it's the ironic thing about this is that, when you're having a lot of symptoms and a lot of fear, like the natural response is like, let's go to a doctor, right? Let's go see a practitioner. Let's try this diet. Let's try these supplements. And the ironic thing about that is that of course, you want to rule out anything medically wrong. We always want to do that in this type of work. But when we're talking about that pain fear cycle, when you're like frantically running around, like looking for solutions, it actually creates more fear in your system. It creates more of that intensity. And so there does get to be a point where, as long as you've ruled things out, like I know you and I have talked about this, like I think we both recommend at a certain point for clients to put a pause on all of that because that can be part of what really spikes that fear response in your body and actually create more symptoms. And so that can be a kind of confusing one, but there's all kinds of things that can really perpetuate this state of fear that we
Yeah.
see come up for clients.
Yeah, I'm glad you brought that up. Sometimes it can be a little bit of a tricky place to be of, okay, how much do you search physically? How much do you not? But you're right, there definitely comes a time where, and there's been a few people I've been very direct about of like, hey, you got to stop searching physically. It's confusing your brain, right? It's totally confusing if you're constantly trying to get scans or x-rays or more tests done or something, trying to find a different solution, but then you're also using mind and body work. It's very confusing for your nervous system.
Yeah, because the mind and body work is trying to teach your brain. The whole goal of that is teaching your brain that your body is safe. And so the act of searching around, getting more scans done, getting more testing done is actually telling your brain that your body is not safe,
Yeah.
right?
Yeah, exactly. And that, there's not, that really there isn't something physically wrong with you. Even if, and we say this too, like, even if you do have something on an x ray, there's, if you keep searching, you will find something because your body's never perfect. There's always going to be something wrong, especially with our spines, especially in the functional medicine world. Always, always, always. So there's always going to be something more you can do. That doesn't mean it's the answer though. And actually, more often than not, it's not. Not only with me, I think I know with you and with many clients, they finally have realized like, oh, yeah, this test might show that I have leaky gut, but actually I've been doing this work and it still shows leaky gut, but I'm actually better or something along
Yeah,
those lines.
your symptoms
Yeah.
go away. And I know I've talked about this here before, but even tests that show that are usually, even in the training that you and I did together, pain reprocessing therapy, it talks about that there's kind of more the mind body realm of symptomology, and then there's the physical side. And you also know, like, something I'm very passionate about is that even when there is something physical, it doesn't mean that you have to have symptoms or as severe of symptoms, because, sometimes when you find something, and I've talked about it here, but I have like severely degenerated jaw joints that create limitations for me. However, when I began implementing this work, my experience of daily living has changed significantly, because I learned how to interrupt that pain fear cycle of where it doesn't have to be scary. I don't have to be scared of the future. And that means that my brain doesn't have to like sound the alarm at me in the form of symptoms, and in the form of pain. And I think that that's like, I get very excited about that, because it's this work is so broad reaching for all kinds of symptoms.
Yeah, exactly. And I have, I mean, personal and client wise, but countless stories of things like
Mm-hmm.
that.
Mm-hmm.
I have some scoliosis in my spine. I do have leaky gut. I got a MRI of my shoulder a while years ago because I was having a lot of pain, and it showed I have a tear, but not where I was having pain, totally somewhere else. They're like, "Oh yeah, you have a pain in your shoulder." And I was like, "Well, but I feel the pain here." They're like, "Well, I don't know, it's all connected." Kind of like they didn't have an explanation. But I hold on to that, right? I mean, obviously something's wrong, something has to be changed, fixed, whatever. That tear is still there. I don't have pain.
And
And that
that's,
happens time and time again.
yes. And that's what's so amazing, is that you truly can like rewire this response in your brain and your body.
Yeah. Yeah. So you work a lot with more OCD, phobias, health related, non health related. Can you give us an example of how health anxiety might present and then actually what we do with it, like how we work to reduce or stop that pain fear cycle?
Yeah. Um, I have a client right now who she presents with, I mean, we've come, I think, up with a list of over 40 phobias that present pretty strongly and have created a lot of restriction in her life. And health anxiety, hypochondria is one of them. And, all kinds of things kind of contribute to something like that. And I think that something that I like to talk about with clients is that usually when you're experiencing a lot of anxiety, health anxiety included, any type of phobia, there's a reason why your brain develops this. It's like an adaptive response that we learn through experience as a child and over time. Usually you've been through things that were scary, and your brain learns to be in a more anxious state as a way to create this kind of like ongoing hypervigilance in your system, as a way to kind of keep you safe from your environment. And so this can get turned into all kinds of things and turned inward into, health anxiety, phobias, all the spectrum. But the way that the base of how I work with all my clients facing various fears is really, really helping them establish safety within their bodies first and foremost, and beginning to like really differentiate between signals that are fear based versus like what is actually true. So we begin to kind of break those things up, right? Like, a phobia that I've been encountering more lately is like a fear of sitting in a chair. And, this is an easy example to give because we can all like rationally recognize that there's nothing dangerous about sitting in a chair, right? And so any type of anxiety, we want to untangle those things, and then begin giving kind of experiential new experiences of safety within the environment of the fear. And so beginning kind of like slow exposure, I like starting with visualization practices before ever going into anything. And, specifically with I do like to rule anything out medically first anytime I'm working with somebody in the realm of health. But then once we have really beginning to help clients learn that they can trust their body, that they can, like, just because they wake up with neck pain, for example, that this can be a really normal, just human experience. It's a sensation. It
Mm-hmm.
doesn't mean that anything dangerous is happening. So, um, does that kind of, I know that's a very
Mm-hmm.
broad, okay.
No, yeah, that's helpful because and I'll even note this too. You're right. The example of sitting in a chair, we want to say there's inherently nothing wrong or dangerous about it. At the same time, I want to normalize it. There's a lot of rhetoric and like health things around, oh, sitting's bad, standing's better. There's so much out there around what's best for your body, walking a certain amount of steps, eating a certain amount of foods, not sitting for long, blah, blah, blah. And if you've had a pain in your back, your any kind of like physical type pain in joints, you probably have been told or talked to about how to sit or how not to sit. Like, well, I can't show you right now, but the way that I'm sitting, I'm always sitting with like a leg up or something, right? Like, or I'll be
Same.
sitting like this or whatever, right? Man, there was a time I was so afraid of that. I mean, I was 24 and told I could never do that. You have to sit perfectly aligned and your desk needs to be perfectly aligned with your height and blah, blah, blah. And yeah, I was terrified to sit like this. It was like, oh my gosh, that's going to make my pain worse. No, I can do this. And if I'm here for, I don't know, a few hours, I get a little stiff, but I move around and I come back, right? There's nothing dangerous. Like, I'm so glad you said that. You're right. There's absolutely nothing dangerous about sitting in a chair in any way, shape, or form at all. And if you've been told that and you're rolling your eyes and like, yeah, but that's this and this because of the structure of blah, 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 just ask yourself, does it really help when you do sit perfectly straight? Are you pain free? Yeah.
My guess is no, because you're so tense in maintaining that perfect posture and so aware that it actually creates more danger signals in your brain and body.
Yep. Yeah.
And when you lean into relaxation and where your body wants to go, everything can relax.
Yeah. Exactly, which is why that safety part is so important. So actually, let's break that down for a second because I'm sure people are like, what does that even mean? Creating safety in the body, right?
Mm.
So I can give an example, but also what would you say? What do you do with your clients when you're first starting off with them and talking to them about creating safety?
Yeah, it really depends on the client, but definitely beginning to create awareness within themselves. So we first, in order to like grow or heal any parts of ourselves, I think it's you have to have awareness of what's coming up for you, right? And so like somebody's just normal state, they may not be aware that they're constantly walking around holding tension, right? So first we actually need to develop the awareness to recognize that literally everywhere they're going, everything they're doing, they're tense, right? So first is definitely that. And then beginning to teach I like sticking with very simple, like accessible, manageable ways for clients to begin bringing safety into their bodies like throughout the day. And so like using various breathing techniques and kind of somatic techniques, very, very gentle kind of like movement or things with our hands. And it's usually, based on what the client's talking about, like they're discovering in their body. But I'll ask in session, if you really check in with yourself right now, like what do you notice physically? Right? Some people that's easy. That's an easy question to answer. Other people, it takes a bit longer to gain that awareness, but that's typically how I begin approaching it.
Yeah. Safety is, well, can be. Eventually, it may not, to your point, at first feel like this, but it's a felt sense. It's a state of being. A lot of times our state of being is like controlled, rigid, tension, tightness, right? And the way to create safety is to start to implement feeling a state of being, a state of relaxation, a state of safety in our bodies, even just a little bit at a time, more and more and more. I love like self-compassion, heart-centered practices. So usually when I ask people, there's always at some point, I don't care how old you are, how long you've been in pain or symptoms, there is a time, at least a time when, and I'll say many times, but sometimes we don't realize it, where you have felt safe in your body. You have felt some sort of warmth, some sort of presence. So it may not come to you right away, but I'll try to figure out, okay, where is that time? When's a time where you felt present? It might be really micro, like, oh, I'm sitting on the couch with my pet and I feel cuddly. That could be a sense of safety. Or, yeah, when I was on this trip, I was so present. I forgot about other things. That's a sense of safety. Or maybe when I gave myself a little compassion, just like a little flexibility, that's a sense of safety. So pulling on when you've already felt it, because you totally have, some way, shape, or form. And I know that could even sound like some privilege because people that have been in really abusive situations might say never. And there might be more truth to that for sure. But we can pull on one something, right? And then we keep increasing that felt sense. It's really that felt sense in our bodies.
Yeah. Yeah, I love that. And once you identify that, I want to kind of build off of that is it can be helpful to kind of use that as it's like an inner resource. So like if, cuddling with your pet is a place where you feel safe, then how can you like draw on that memory in your brain and body, right? Because when we think back on those types of things, we can often recreate that feeling in our body. And so when you're noticing states of anxiety and stress, you can then kind of pull that memory in and create that sense of safety within yourself.
Yeah. Yeah. And this brings us to what we were going to talk about is like the tips to work with health anxiety. This 1000% would be the first one, just to start to establish that idea of what it feels like to be somewhat safe, to be out of that anxious mind or anxious state. And understanding too, I don't want to dismiss the, brain cognitive side of this because it can be helpful to actually understand. Actually, I think you said this to your point earlier of understand that, yeah, inherently sitting in a chair is not scary, is not dangerous, and bring some cognition to this whole process of actually your body is safe and it's really just signals of danger. It's just a stressed out nervous system that we need to help shift. Right. So that idea or just the understanding, the education can bring a lot of relief. Sometimes it's not the whole picture, but it can really help you understand, okay, what's going on. Because again, kind of what we were saying is that so much anxiety comes from the unknown of not knowing what's going on or not knowing what's going to happen. So if we can help bring a little, like release the valve on that unknown a little bit, that's one of the first steps of bringing awareness to all of it. Yeah. What else would you say in terms of a tip for helping to establish or helping to work with health anxiety?
We talk about somatic tracking a lot of times for working specifically with symptoms, but I love it for anxiety as well.
Mm.
Um, all somatic tracking is observing without bringing meaning to it, observing and not connecting fear to a symptom. And I think of anxiety as another presentation of a symptom. It's not, the traditionally thought about like physical symptom, but it does create physical sensations. And so all of that is truly like observing what's happening within you without attaching meaning to it, just allowing it to be. Right.
I want to point that out that the anxiety is a symptom. I don't think we've named that. And I think it's really important to name.
Yeah.
Because you're right. Anxiety is a symptom. It's not a feeling, even though people describe it as a feeling. It's not an emotion. It is a symptom of something else. And usually when I introduce that idea to people, they're like, huh. They think about it for a second. They're like, oh, it's not an emotion. It's not a feeling. No, anxiety is a protective mechanism. It's a way that your brain and your nervous system are trying to protect you. So it's a symptom, just like any other symptom is a mechanism to try to protect you. And so it makes total sense we would work with it like a symptom. Yeah. Yeah. Thanks for naming that. Anything else on this? I see you nodding.
No, I'm just
Just like,
agreeing. Yeah.
yeah. Yeah, totally. Yeah. So another tip I want to talk about is helping you find evidence for your life that your symptoms are not physically rooted. So the way that we talked about the anxiety fear cycle is a cycle because like your symptoms bring on anxiety and your anxiety brings on symptoms. Kind of the same way with finding evidence. Like when we have experiences of feeling safe in our bodies, or we have experiences where we recognize, oh, I'm not having symptoms in this scenario. So associated with this trigger, it gives our brains evidence that we don't have to have symptoms all the time. So creating an evidence journal is really powerful. Writing down all the times that you don't have symptoms, like, oh, I was with friends, or oh, I went out to dinner here, or oh, I was, yeah, cuddling with my pet and I didn't have any symptoms. Writing them all down so that your brain can really recognize that, one, you don't have to have it all the time. And you can really recognize too that it doesn't have to drive your life. And actually, there isn't anything wrong with you. It's not happening all the time. Because a lot of times we think, like, well, I have this pain or I have this fatigue and it's there all the time. But actually, if you really look at it, it's not. It's not. There are times where you don't. And that evidence journal can be that, because you keep orienting yourself towards the place of, oh, yeah, I have times where I'm not in my symptoms. And then it gives your brain that validation. And that can be really powerful to realize.
Yeah, a question I often ask that can help find these times is like what someone's favorite things are to do, what brings them joy.
Mm,
Because often when we're fully engaged in experiences and really enjoying ourselves, we're in the present moment. And when we're in the present moment in more of a flow state, that's going to be in the parasympathetic part of our nervous system and the relaxation part of our nervous system. And so it's much easier for our brain to be looking at the world through a lens of safety, right? And that includes our body. And so we'll often find that during times like that, symptoms go away. Clients will often say, I just kind of forgot about them for a while. And if you're forgetting about them, they're probably not there. But that can be a helpful question to ask to help build that evidence list that there are times that your symptoms go completely away or at least decrease significantly.
yeah. Yeah. I love that one. And if you're here thinking, well, it's never, try it. Just try it. Just try observing your day, seeing where it isn't, seeing where it is throughout the week. Maybe give yourself a week, not just one day.
Yeah, and observe versus like watch like a hawk, right?
Yes.
Because the energy that we bring to the different things that we talk about also impacts our brain state, right? Gentle observation is very different than like very intense kind of seeking out, like, when is it not there? It's going to be there. Is really different than, I wonder if there are times that I really don't feel anything. I wonder when I feel good. I wonder if it's
Yeah.
possible if I feel good sometimes.
Yeah. That sense of curiosity is a big one. And I want to normalize too that that can be hard sometimes when you're really stuck in it. I remember trying to do this. Like I always I grasped it, I got it. I read all the books, all the spiritual books about being curious. And I did it. Like I would try it, but I still felt like I was faking it, like, okay, I'm being curious. But I still had this sense of like intensity with it. I'm gonna force this curiosity. So just keep doing it, keep practicing. You'll feel it. Once you start feeling that sense of wonder and curiosity, you'll start to kind of grab on. But sometimes it takes a little time.
The process.
Yeah. Yeah. Okay. I feel like we got into a lot of good stuff. Is there anything else you feel like is important or something, you want to wrap up with?
Um, I think I feel like we've covered a lot too. I think one thing is that I often hear clients talking about feeling like their nervous system is broken or damaged, um, or like their body is broken. And I think that's something I like to talk about too. It connects back to like our brain and body are always trying to protect us. Like there's reasons, whatever it is that you're dealing with has come about. If you're feeling that way, working on shifting your perspective to recognize that your brain and body really are trying to help you. And it's not broken. This has become an adaptive response for you, and really teaching your brain and body that it's safe is possible. And so, like with consistency, like utilizing the things we talked about today, it really can learn that you're safe and that your body is safe.
Yeah. Thanks for that. That's a beautiful way of saying it. I think that I'm going to leave it there. It was a great way to end. You can see below about, what I'm offering and how to get in touch with Liana. And if you have not yet and you want to see us on YouTube, we are on YouTube. So you can watch if you like to watch, listen if you like to listen. And until next time, just keep treating yourself with so much compassion, so much grace, and we'll talk to you soon.